Hello everyone, this is Dr. Tapos and welcome to our channel Barnagar Physiomax Organization. Again today we have gathered to know and to share you few of the knowledge regarding one of the radiological findings, and we can see one spine, lumbar spine X-ray in front of us, and today we'll show you what are the most common findings we used to see whenever there is a traumatic spinal injury. So that is about our today's education, and today we will see this X-ray. So as you are seeing in this X-ray, this is the AP view, and this is the lateral view, and this is the lumbar region, and this is the lumbosacral region. So before I describe the X-ray to you people, I just make you understand that with the history of the patient, this patient he just used to work in a private company, and just few days before he just fall down from his cycle, and he has a trauma. He was a trauma, and the trauma it was on the lower lumbar region, and after that he was not having that much of pain, but the time he used to bend forward, that time the pain used to come. So with this history, you went few of the physicians, and they have referred with few of the analgesics, and he has taken I think 2 or 3 of steroid injections. Then the pain also not subsides. After that he had advised with us, and we make him to do the X-ray. So the time we saw the X-ray, there was two very there was two areas where we found there was a pathology and there was a problem. That for that only we are sharing this video with you people. So first we'll see what exactly we found on this lateral view. This is the lateral view, and if you notice, this is the sacrum, and this is the L5 spinal vertebra. And the time we was noticing this, we was just seeing the L5 vertebra properly, we saw there was a fracture, and this region, it's called as a pars interarticularis. This is the region it's called as a pars interarticularis, and we can see there is a fracture in the pars interarticularis, and just because of this fracture, the spinous process of the L5 spine, it got separated from the L5 vertebra. So we can see over here this fractured spine. This is seen in the lateral view, and it is what it is called as a spondylolysthesis. So this condition, it's named as a spondylolysthesis. So what is spondylolysthesis? When there is a fracture in the pars interarticularis, and resultant the spinous process and the vertebral body, it is to get separated. That's what it's called as a spondylolysthesis. As all few of us, we know that the time there is a spondylolysthesis, this bone, it looks like a Scotty dog. So we can see Scottish dogs or Scottish dog. So this is how the Scottish dog looks like. So that's what is the Scottish dog appearance whenever there is a spondylolysthesis. Now, if you want to grade this, we can grade it as a grade 1. So because there is a very minimal displacement, we can see only the hairline fracture. If it is a grade 2, there is a 50% of the displacement, and if it is a grade 3, it's a 75% of the displacement, but he is having a less than 25% of displacement. He was having just a fracture. So we can grade it with a grade 1 of spondylolysthesis. So this is what we can find from his X-ray. That's the spondylolysthesis of the L5 spine vertebral body. And if we see the lumbosacral angle, it's bit okay. If we see he is having a mild degeneration, he is having osteophytes, it's okay with this age. He is having age of 50, so it's quite normal. And the curvature, it's okay. No other areas he is having any fracture sites. So one findings we got from the lateral view. Now slowly we'll move to the AP view. We are seeing the AP view. We can see both the sides the sacrum, we can see the SI joints, we can see on both the sides the SI joints. This is the sacrum, and this is both the sides is the pelvis. This is the SI joint. You can see the L5 vertebra, you can see the L4, L3, and go on. You can see the ribs. Now we'll see, is there any pathology in this particular region or not. So we'll see the spinous process. We'll start with the T12, L1, L2, L3, L4 spinous process. We can see it's quite proper. The time we will see the L5 spinous process, if you just notice it properly, see this, the L5 spinous process is bifid, but it's supposed to be the unifid. That means it is having a single phase. But you can see again there is a fracture in the L5 spinous process. So that's the second findings from his X-ray. He is having a L5 spinous process fracture over here. So this is the finding. So this is the second findings from his X-ray, that he is having a L5 spinous process fracture. This is the second findings. So now coming to the any other areas, anything we can see or not. When we went to the SI joints, yes, the margins is quite okay, so it does not have that much of SI joint arthritis. Again, the curvature is in a neutral position also, it's not in a tilt. Any other spinous process is okay. But if you see the transverse process of the L5, see, this is the L5 transverse process. Again, it's about to touch with the iliac crest. It's about to touch with the iliac crest. So there again there is a chance of having a friction and a fusion of the L5 transverse process bilaterally. It's in both the sides. So bilaterally it got fused with the, or about to fuse with the iliac crest, and this what it's called as a lumbar or sacralization. So this the L5 vertebral body. When the L5 vertebral body is transverse process bilaterally, it is to get fused with the iliac crest. It's called as a sacralization. The L5 vertebral process, lumbar sacralization. It's about to happen. So for this person, there is three findings from the lateral view. We can get one is the grade 1 spondylolysthesis. From the AP view, we can see the spinous process fracture, and we can see the transverse process which is about to touch with the iliac crest, and that's what is called as a sacralization. So today we discussed with you a traumatic spinal injury and the views of the traumatic spinal injury. So a few of the times whenever a patient will come to us, sometimes we forget to do a X-ray, and without doing a X-ray, the time is to assess a patient. This type of findings, it's very difficult ways to neglect, and that may result in long-term complication, because just because of that there might be a compression of the cauda equina, and that can hamper a lot of neurological complication, that can bring a lot of neurological complication. That's what is important for this particular radiological view. So we'll end up with this today, and we'll come up with a few other educational videos so that you will understand a lot of things. So this is your Dr. Tapos. Those who watched this video, don't forget to like this video, and those who are new for this channel, don't forget to subscribe this channel. Thanks everyone.